Good afternoon. Good afternoon. Today we're going to detail some additional measures we're taking to deal with COVID-19 here in the Commonwealth as we approach this holiday week. But first I want to give a quick update on our COVID numbers. Yesterday the Department of Public Health reported 3,760 new cases of COVID-19 on just over 61,000 tests. 1,991 patients are currently being treated for COVID-19 in hospitals in Massachusetts, and 410 patients are in the ICU. This fall, when Massachusetts and most of the region started to see an increase in infections, the Commonwealth responded accordingly. We deployed teams to assist nursing homes and amped up our testing there. We rolled back the reopening process. We issued a new stay-at-home advisory, and we strengthened our face covering mandate. We restricted what types of procedures hospitals could perform and worked with them to increase their capacity, and we opened up 2 field hospitals. Our administration's also outlined guidance to urge folks for just this year to celebrate the holiday season with those in their immediate household. And if they plan to do anything other than that, to follow the guidance, wear a face covering, maintain distance, don't share food, wash your hands, and remember that in many respects, the people you are safest with, especially during this season of the year, are going to be the people you live with every day. Combined, those steps at the time helped our hospital system add hundreds of beds. And in November, many of these steps were effective in slowing the growth of new infections, but unfortunately that progress was temporary. After Thanksgiving, infections and then hospitalizations skyrocketed, and since then, we've seen that increase slow down slightly, but certainly not enough. Before Thanksgiving, our hospital's acute beds were about 67% occupied. By December 15th, that shot up to around 83% occupied, and we've only recovered 1 percentage point since that peak. Our hospitals are now under significant pressure, and we're heading toward another period, this holiday stretch, when we're likely to see another significant increase in cases and hospitalizations unless everybody plays a very different game than the one we all played at Thanksgiving. As a result, we think it's appropriate to take action now to slow that spread, and we must do so in a way that can avoid overrunning our hospital system. So today we're announcing new statewide restrictions that will be in place for at least 2 weeks, starting Saturday, December 26th. These will be in addition to our existing orders, including the stay-at-home advisory, the face mask requirements, and the early closures that are already in place. Together, the intent of these restrictions will be to pause activity and reduce mobility so we can reduce the spread of the virus without closing our schools or our businesses. The details: effective Saturday, December 26th, capacity limits will be lowered to 25% for most industries, and the Lieutenant Governor will talk more about the details on this shortly. Indoor and outdoor gathering limits will be reduced to 25 people outside and 10 people inside, including for events. This is part of what we must do during this critical period when the vaccine is just a few months away to slow the spread. If we can all agree to do the things that slow the spread over the next 2 weeks, it will help us work on building the bridge we all need to build to the vaccine. Nothing we're announcing today affects anything associated with K-12 education. That guidance is already in place. And as the science and medical data has made very clear, all school districts, even those with high infection rates, can and should bring students back into the classroom. In fact, these measures today will help districts bring students back and bring them back soon. The decision to restrict capacity at so many businesses is an enormously difficult decision. We all know that these decisions carry very negative ramifications on people's livelihoods and their families. The economic package that was passed by Congress will go a long way in addressing some of the financial damage that these restrictions will have for individuals, families, and businesses. But we also know that more help is needed for businesses that are struggling to keep their lights on, and our administration is putting together a significant economic relief fund for the Commonwealth's small businesses that will be most negatively affected by these decisions. And we will present the details on this package tomorrow. Let me just close by saying that we all know that COVID-19 is relentless. Some people become very sick, others have lost their lives, and for many, it's a mild or a non-event. It's been a hard year for our employers and for thousands of their workers and their families, and it's been a hard year for everyone as we try our best to stay apart and to cancel important milestones and celebrations and change, in many respects, the way we celebrate almost everything we do. Christmas is obviously a few days away. We're in the heart of the holiday season, and it's normally a time for joy, for gathering, and for relaxing and hanging around with those we love. This year obviously is different, but we all need to hang in there, stay vigilant, and recognize and understand that the work we do now has a lot to do with the kind of bridge we build to get to the vaccine. Over 26,000 clinical and non-clinical workers in our healthcare settings have already received their first dose. Moderna received its EUA authorization last week, and the first shipments arrived yesterday, with more being delivered today and tomorrow. We have a robust plan to get vaccines to people as quickly, safely, and equitably as possible. Two-dose vaccinating almost 7 million people will obviously take time. And in these coming weeks and months, we need to bear down on the virus and keep practicing the prevention that so many have delivered on for months here, just a little longer. Wear a face covering, avoid groups, and stay home except you need to go to work or go to school. And do all you can, if you're not going to be with the people you live with, to take proper precautions. This will help us all get through the next push, and it will help suppress the growth of the virus and make sure that our healthcare system can withstand this surge and continue to serve the many people who need it to be there for them who aren't dealing with COVID. And it will also help us keep our schools and our communities open. These messages, we know, are hard to deliver, and believe me, we know they're hard to hear. But we have full confidence that the people of this great state will continue to dig deep and come together in the final stages of this terrible pandemic. With that, I'll turn it over to the Lieutenant Governor.
Thank you, Governor. As the Governor said, the decisions we have had to make throughout the pandemic have been incredibly difficult. And we know that they have resulted in hardship and difficult times for business owners, for operators, for businesses of all sizes in all places across our Commonwealth. Over the last 10 months, the downtowns and small businesses have remained top of our minds. Small business owners have been patient and committed to the safety protocols and standards that we put in place to protect workers and customers and to help us get the economy moving again. We are grateful and we are thankful for all that you have done throughout this pandemic. We know it's been a sacrifice and we know it's been a ton of hard work. These businesses and workers, they're our friends, they're our neighbors, we know them well, and they need our help now more than ever. We've said it before, tough times don't last, but tough people do. These times have been incredibly tough, but we will get through it, and we will get through this together. We will get through this together. Now, I'd like to go into a little more detail on the capacity and gatherings guidance we are issuing. The restrictions we are putting in place will be in place for at least 2 weeks, as the governor said. It is our goal to keep these measures temporary. Capacity limits will be lowered to 25% for most industries. They are as follows: restaurants and personal services, theaters and performance venues, casinos, office spaces, places of worship, retail, driving and flight schools, golf facilities for indoor spaces, libraries, lodging for common areas, arcades and indoor recreation business, fitness centers and health clubs, museums, cultural facilities, and guided tours. Workers and staff will not count towards the occupancy count for restaurants, personal services, places of worship, and retail businesses such as grocery stores. Again, workers and staff will not count toward the occupancy count for restaurants, personal services, places of worship, and retail businesses such as grocery stores. All other rules and restrictions in each sector-specific guidance will remain in place. As the governor stated, indoor and outdoor gathering limits will be reduced to 25 people outdoors and 10 people indoors. This will apply to private homes and event venues and public spaces. Tomorrow specifically about state funding that will be made available to small businesses to help keep the lights on, to pay the bills, to meet your payroll. As we get into the holiday week, think about supporting, we'll do more than think about. In the days leading up to the holidays, buy your gift cards from your restaurants and your local shops. Plan on takeout meals. Do whatever you can to help support the small businesses, your local restaurants, your local retail, the places that are familiar to you. Go visit them and do your part, as you have been doing, so we can all continue to see these businesses through these challenging weeks ahead and see them on the other side. I know this pandemic has been hard for everyone, but there is light at the end of this tunnel. Vaccines are here, and thousands of Massachusetts, thankfully, have already received their first dose. So let's dig in a little bit further. We'll continue to do our part to fight this pandemic just a little longer. We all know there are better, brighter, and healthier days ahead. With that, I'd like to turn it over to Secretary Sudders.
Governor, Lieutenant Governor, Secretary Keneally, good afternoon. Effective 12:01 a.m. on December 26th, all hospitals must postpone or cancel all non-essential inpatient elective invasive procedures unless postponement would lead to high risk or significant clinical decline of an individual's health. Additionally, hospitals should not schedule any new inpatient non-essential elective procedures until further notice by the Department of Public Health. Non-essential elective invasive procedures are those that are scheduled in advance because the procedure does not involve a medical emergency and where delay will not adversely affect an individual's health. To be clear, we are not shutting down health care. Ambulatory, outpatient treatment, preventive procedures, including mammograms, pediatric appointments, radiology, cancer screenings, are not impacted. Inpatient and emergency services remain open. We take this important next step to preserve inpatient bed capacity and our clinical resources, including staffing to redeploy staff as necessary and to prepare for flex surge capacity as needed. It is clinical judgment that will guide these decisions on a case-by-case basis as to what can be safely postponed or canceled until a later day. As with every decision we make, we must ensure that our healthcare system can meet any acute care demands for our residents. As you know, part of our healthcare response to ensure sufficient capacity has been the standing up of field hospitals or alternate care sites. The field hospitals provide acute care for COVID-19 positive patients who need a low to moderate level of care. The Worcester Field Hospital at the DCU Center currently has 26 patients with a staffed capacity of 50 beds. Since opening, they have treated and discharged 100 patients with an average length of stay of just under 4 days. While the facility can accommodate up to 200 patients when completely full, it has been designed in units which can be stood up independently in 25 pod units. In the coming weeks, the second field hospital will open and accept patients in Lowell. Alternative care units or field hospital staffing plans are flexible, and we can modify them by the medical director as needed. These sites provide top-notch care, as you may recall from the spring. We are still calling out for and recruiting staff for Lowell. I am particularly calling out for nurses and patient care associates to apply for this very important work. Please visit lowellgeneralresponds.com. We need you. Again, that's lowellgeneralresponds.com. Finally, as we do come into these holidays, a few dashboard housekeeping items. There will be no daily dashboard published this Friday, which is Christmas, and next Friday, New Year's Day. Both daily dashboards will be published the following Saturday, December 26th and January 2nd, respectively. And finally, the first vaccine dashboard will be published this Thursday. Thank you. Now it's my pleasure to hand it over to Secretary Keneally.
Well, thank you, Governor, Lieutenant Governor, and Secretary Sutters. Back in October, we announced our $774 million plan known as Partnerships for Recovery to stabilize and grow the Massachusetts economy. We continue to implement this plan, making targeted investments to revitalize downtowns, support small businesses, and get people back to work. Part of this plan was yesterday's small business grant announcement. The $49 million in grants through Mass Growth Capital Corporation will benefit 1,158 small businesses who can use these funds to pay their employees and to cover rent and utility payments. However, this program also offers a stark view of the challenges facing small businesses. We received over 10,000 applications for the program, and while we were pleased to award the $49 million, that was just 10% of the $500 million requested. We appreciate the sacrifices of our small businesses, and we recognize the great need that remains as the virus surges and people stay home. Our reopening strategy has always been led by public health metrics, and that's why today's new statewide restrictions are necessary. Soon, we will be connecting our cities and towns that applied to our local rapid recovery planning program with teams of experts who will help them create effective strategies to stabilize business districts. Programs like MassDOT's Shared Winter Streets and Spaces and Mass Development's Commonwealth Places will continue to put funding towards helping communities adjust their commercial districts. Where there is a need, we continue to look for ways to direct resources there. Our economic development and recovery bill is a key piece of our work in many areas, including millions of dollars for small businesses, as well as important support for new housing construction and emerging innovation sectors. Finally, we are working to craft a new state fund that will bring additional relief to our struggling small businesses, and that in turn aids the families that operate them and the employees that power them. We'll have more on this tomorrow. The hope is to deliver funding that meets this moment, is tailored to our local needs, and that complements recent federal action. Thank you.
Questions?
If gatherings are the biggest concern in household spread and family gatherings, like we saw right after Thanksgiving, if that's what's driving this, how will limiting capacity in businesses make a difference?
Well, there's a couple things with respect to limiting capacity. One is there are a number of studies that have been done at this point that show that if you do limit capacity, take it down significantly, you do limit the amount of infection that typically takes place inside those organizations. Secondly, by limiting capacity, we are sending a message that we would like to see people spend the next couple of weeks between Christmas and sort of the week after New Year's with as regularly as they possibly can, just with those they live with. And if you need to go out and do something, go out, get it done, and come home. You know, before Thanksgiving, there were a whole series of metrics out there about travel. And all of them painted a picture that indicated that Thanksgiving was not going to be the kind of holiday it had been in previous years, which we viewed as a positive. And then literally 7 days after Thanksgiving, case counts basically doubled in Massachusetts. Hospital trends followed. And in the conversations that we have every day with the hospital community generally, you literally had the heads of a number of hospitals saying they could see the intergenerational transmission that was taking place in the people that were coming through their emergency room. The average age was suddenly going up where it hadn't for months, not by a year or two, but by literally far more than that, to the point where many of them are back to where the average age of their inpatient population is now the average age of their inpatient population back in the spring. And one of them even said, I could see that transmission from the kid who came home from college, delivering it on an asymptomatic basis to the senior members of his family.
But Governor, Chris,
And I think most important thing we want out of this is to make absolutely clear to people that the best and most safe thing we can all do for the next few weeks is to spend as much time with those we live with as possible, and to not treat the period between Christmas and New Year's the way we normally do, which is a constant race to connect with, catch up with, hang out with, grab a drink with, grab a meal with, all those people you haven't seen since the last time you saw them last year. And I think we all get the fact that that's a tough message, but it's the right message for the moment. And as I said, we know what this means for a lot of our small businesses, especially those in the restaurant and indoor entertainment venue activity, which is why we'll be back here tomorrow with a plan for them.
Timing of your protocols, just people are going to be saying, well, I'm going to go to Mass Christmas Eve, I'm going to go do my last minute shopping. Why not today versus Saturday?
Well, the main reason we picked the day after Christmas instead of the day before Christmas was we know that many people hopefully will participate in a faith service of some kind safely on Christmas Eve or Christmas Day. Now, it's perfectly possible to do that safely. And we would hope people would follow the rules, follow the guidance, do the things we've talked about if they choose to do that.
Governor, public health experts and mayors have been calling on you to do this sort of thing for weeks now. Can you tell me what changed your mind?
Well, nothing really changed my mind. I just pay attention to the data. And with respect to the data here, we started to see a downturn after we put some of our original restrictions in place in early November. And then literally 7 days, as I said, after Thanksgiving, after all the messaging and all the commentary about why it was important for people to try to spend that holiday and the days around it with the people in their household. 7 days later, and for the next 7, we saw a big bump in positive cases, and then the hospitalization that came after it, and a significant increase in the age of the people who are ending up in the hospital, which spoke directly to this notion of transmission that was taking place between younger people and older people. And here we are coming into this second big season with respect to the holiday, and we think it's critically important for people to hear us when we say people really need to spend this in a very conservative and cautious and careful way. And we believe reducing occupancy across the vast majority of venues in Massachusetts, 25%, will accomplish that in any of those places that abide by those rules, because it will dramatically limit the number of people who are in any of those places at any one time. And secondly, sends a pretty loud signal that people really need to take this seriously.
But by the time you send that signal, the holiday travel period is over. We just went to Logan this morning and it was kind of crowded.
I'm not really sure I would have expected that at the end of the day, we could drive people away from coming home who were planning to come anyway, okay? But we do have all kinds of rules associated with that, associated with quarantining or getting a negative test either 72 hours before you leave or 72 hours after you get here. And I certainly hope people abide by those rules and that guidance. But it's critically important for the next couple of weeks that people don't do a lot of the things that they would typically do when they come home or when they celebrate the holiday. I mean, a lot of people don't normally work the week between Christmas and New Year's. Schools aren't in the week between Christmas and New Year's. There's a tremendous amount of the kind of activity that can have a very powerful and significant impact on case counts and ultimately hospitalizations that would normally take place. We're doing everything we possibly can here to limit a lot of that and to make clear to the people in Massachusetts about why it's important, given what just happened in the aftermath of Thanksgiving.
Governor, why are casinos still on the list of being open?
25% capacity. They're basically managed, and the rules they operate under are developed and incorporated by the Gaming Commission. And I do believe that that 25% limit will have a significant impact on the number of people on site, provide a lot of distance between and among the participants, and they do follow extraordinarily aggressive safety protocols, and they still have to close at the same time everybody else has to close out, which is 9:30.
Is Secretary Sanders able to give us an update on the timing of the vaccine with the new category being moved in and some of the hiccups? And also, if right now they schedule still to start on the 28th, the long-term facility?
Yeah.
And will, if they have cases there, will they delay their vaccination?
There's like 65 questions.
I don't want to shout over.
Okay, so, and you might have to repeat a few of them. So let me just give you a quick update on vaccines, and then you can tell me what things I forgot in your questions. So at this point, we have the 120,000 doses for this month for Moderna, and all but 3,900 have been allocated. So 116,100 doses have been distributed from starting yesterday through Wednesday, which is terrific news. And the 59,475 Pfizer doses were also distributed. Next week, starting the 28th, the long-term care pharmacy partnership starts. And that is, the communication is directly from either CVS or Walgreens to facilities. But I can tell you for the two soldiers' homes, there has been outreach to family members who are the guardian, because it does require consent. And the good news was both CVS and Walgreens modified what the consent requirements were. So we're going to send an abridged form to the guardian, but the guardian could also call the home, and the staff can fill out the consent as a verbal consent as well. And so those went out. They started going out yesterday. So we're expecting the 28th. we will start to see skilled nursing facilities in Massachusetts be vaccinated. All right, and what were the rest of your questions?
Just the only other element was just if there's an active case in the nursing home or wheelchair, so will that impact the timing?
We will, we cohort patients accordingly. Obviously, it stops, we stop visitation, but we would not stop vaccination of staff and residents. And again, it's voluntary. And the good news was both Walgreens and CVS helped sort of a very, I saw the original consent form, which was quite long, and then this is like the very short modified form. And again, families can call and we can fill out the form for them. So to try to expedite the process.
You're still expecting 120,000 Moderna doses by the end of the year. That hasn't been reduced?
No. So in fact, the $120,000 doses appeared in Tiberius, and we have allocated 116,100 of them, and 3,900 it's all but 3,900 have been allocated. So yes, started yesterday, today, and tomorrow. So that 120,000. So yeah, feeling good about that.
I was wondering if you could explain the reasoning behind dropping the populace to 25% for 2 weeks rather than make it a true 2-week policy to just shut everything down?
I think at the end of the day, our view is based on a lot of the data we saw. You get down below 30% and you start having a pretty significant impact on infection rates generally. And I think for many businesses, the pure closure of the operation requires shutting all kinds of things down that are then hard to start up again at some point later on. And as the Lieutenant Governor said, this is deemed to be a temporary move to deal with a very particular and very specific issue associated with what would be the typical approach that most people would take to that period between Christmas and New Year's. And we'll see where the data is and what it says with respect to whether it goes longer than this. But I think this is a much more appropriate way to deal with it than to just lock everything down, tell everybody to stay home.
Governor, I'd like to ask a question I asked yesterday. You needed more time to look at the CDC recommendations about vaccine schedule. Have you had a chance to look at that? And are you thinking about maybe moving some things around for phase 3?
There's an advisory group that was set up by the command center to review the decision-making. In fact, several of the members came and presented here when we originally went forward with our proposal. They currently have the CDC recommendations that they made, and we expect to hear from them this week on it.
Governor, you say you usually look at 3 weeks of data to make a decision, so I'm curious, why are we just doing 2 weeks to start, and how likely is it that we're just going to do this for 2 weeks?
We do usually look at 3 weeks of data, and as I said, we have seen a leveling off of the case trend. But the holiday is upon us, and I think from our point of view, the look in the rearview mirror at the impact that Thanksgiving had made it important for us to put a message out and some guidance changes out prior to the arrival of the next holiday break, which is, of course, this period between Christmas and New Year's.
Governor, you have a sign the police reform bill?
So we sent back to the legislature. We filed the first police reform bill. I think many of you were in the room when we did that back in June with members of the Black and Latino Legislative Caucus. We sent back to the legislature a bill that represented what we would sign. And subsequent to that, we had conversations with the caucus, and they raised concerns with a number of issues that we made adjustments on based on those conversations with them, which we then shared with the House and with the Senate. The Senate, as I understand it, adopted the changes that we made based on the conversations we'd had with the caucus and with some of the folks in the Senate. If that legislation travels through the process and comes back to our desk, as we believe it left the Senate, we would sign that, yeah.
Governor, address some of these issues with unemployment claims that we're still hearing that people can't get through to a human being. It rings and rings, they're on hold, someone hangs up. Is there a staffing problem? Is there any way that you can
What I can tell you is that I know what the average speed to answer at the Department of Unemployment Assistance is, and it's under a minute. So when you say to me that there are all kinds of people who can't get through, I have a really hard time reconciling that with the information and the data we get from the DUA on a pretty regular basis. And what I have said, which I'll repeat, is if people can't get through to the DUA, they can call my office, call our constituent service office, which many people have over the course of the past month or so, and they will make sure that they find a way to resolve whatever the question is. I will also point out that in many cases, when we dig into these, and I follow every single one of them up that ends up coming through my office, the overwhelming number of issues that we run into is people don't accurately fill out the application in the first place. And I can't express how important it is, if people are having trouble getting their claim processed, that they talk to their employer and they make sure that the information they submitted is consistent with the way their employer is actually accounted for in that system. Because it's not just your unemployment application when you file it. It's also an unemployment application. If you're filing under the traditional system, it's an unemployment application that will be booked against your employer, which is why it's so important that both of those things sync up in the system. Because the unemployment system needs to, if you're filing under the PUA program, which is for self-employed people who don't work for an employer, who participates in the UI system, that's different. But if you're filing under the traditional UI program, the traditional unemployment insurance program, the employer name that you enter needs to be the same one that the unemployment insurance system believes you work for in the system, so that those two things link up.
Governor, you said yesterday that you would wait to see what the legislature said on the abortion issue.
Yep.
But they both passed, they rejected your amendment, and needs some minor, I think, enactment, routine enactment stuff.
Yep.
Sticking with that, that you can't wait, you can't say anything before you get that.
I like to wait and see what actually gets to me before I make these decisions. I'm making an exception with respect to the police bill because we have had a series of very complicated negotiations and discussions with a lot of different people, and I think it's important for us to make absolutely clear about where we believe we are on that issue at this point in time. But the other one, I'm going to wait till it gets to my desk and we'll read it and see what it looks like.
Thanks, everyone. I just have one more question. In terms of aids for businesses, you mentioned the big gap of what we were able to award yesterday. Is the PPP loans that were just awarded by Congress going to be enough to fill that gap, or how much more do you need to do?
So I think I can answer this one for Mike. We believe that the program we're going to come talk to you folks about tomorrow is very significant for a state-based program for small businesses and those who are affected by this 25% capacity limit. But our $775 million economic plan that we announced earlier this fall is dwarfed by the fact that in Massachusetts alone, businesses acquired $13 billion in PPP loans. And the numbers the feds are talking about in their current package for small business support of one kind or another nationwide is $325 billion. I mean, the number of zeros they play with is profoundly different than the number of zeros we play with. Let's get back to the unemployment piece for a minute. The PUA program, which is critically important to people who don't actually collect unemployment through the traditional system, and this program was basically put together specifically to deal with the pandemic for self-employed individuals, that thing ended on 12/31 until that stimulus package got passed. And unemployment insurance for many people who participate in the traditional program, they'd run through their weeks, and it was going to end for them on 12/31. And in some respects, you know, I've said this before, when we were talking about the possibility of the feds implementing a stimulus before the end of the year, there's a lot of really important support in there for people who are out of work or who may be out of work going forward, for small businesses of every shape and size you can think of, and for additional money for testing, additional money to support the administration of the vaccine rollout, additional resources to support rental assistance during what is a very tough time. The legislature's done great work on that, which we've really appreciated, to expand the size and scale of the RAF program, which is our primary tool through which we support rental assistance. But when the feds come in, the amount of resources that come with those make a really big difference in terms of our ability to leverage what is a much bigger set of tools than the ones we typically have available at the state level, which is why it was so important for them to get that done by the end of the year.
Thanks, everyone.
Thanks, everybody.
Thanks, Coach.